that he said that they could keep it, and they now can't. I yield the floor.
Mr. President.
The senator from Utah.
Mr. President, the President of the United States promised, if you like your plan, you can keep it. We now all know that that simply wasn't true. And though many of us have been saying this for years, many Americans, including many in my state, are realizing the pain of the President's false statement. Dave from Utah says, my company just dropped the good insurance plan we've had for years due to Obamacare. The Affordable Care Act is costing me more money. I'm barely able to keep my family out of poverty, and now health care is going to cost me even more. Please do something to change this. Marcy from Utah says, we own a small business in Utah, and we will be forced to cancel our insurance and ourselves go on Obamacare. We can start over with a new way to fix our health care system. But starting over doesn't necessarily have to mean starting from scratch. We should take those lessons that we've learned, and we should build around the concept of a market-driven, patient-centered health care system, one that empowers individual Americans to choose their own health insurance based on their own personal needs and based on their own preferences. Thank you, Mr. President.
The senator from South Carolina.
President, I have two stories I'll quickly share with the body from South Carolina. Scott from Goose Creek, South Carolina. I'm a college professor in Columbia, South Carolina, at a private university. We're up for our insurance open enrollment. I'm 35 years old, vegetarian, never smoked, ridiculously low blood pressure and cholesterol. Obviously, I have nothing in common with Scott. I noticed the following about my policy. My share of premiums went up by 35 to 40%. In addition, my actual policy changed. My deductibles tripled from $250 to $750. I cannot get regular monthly prescriptions at my pharmacy now. I'm sure there are other changes that I have not examined close enough to notice. Thomas Dougal from Elgin, South Carolina. After submitting his personal information on healthcare.gov, received a phone call from a Mr. Justin Hadley, a North Carolina resident, who informed him that when he signed onto healthcare.gov, he received all of Mr. and Mrs. Dougal's personal information. This is beginning to be a very famous case. 572 people have been enrolled in Obamacare in the state of South Carolina. Mr. President, Obamacare is not working, and I fear it will never work, and the best way to fix it is to repeal it and replace it with something that will work. I yield the floor.
Mr. President.
The senator from Utah.
Mr. President, I have received letters from my constituents all over Utah who are scared, angry, and confused about the changes they're already facing under Obamacare. I've heard countless stories from Utahns that are losing their coverage and will be forced into more expensive plans thanks to the so-called Affordable Care Act. One such story came from Kathy in Salt Lake City. I spoke briefly about Kathy here on the floor a few weeks ago. Kathy wrote to tell me how she was notified by mail that her existing health care plan was no longer going to be offered. Instead, she was presented with an Obamacare-compliant policy that will increase her deductible from $3,000 to $5,000, increase her co-pays for doctor visits to 30%, and increase her co-pays for prescription drugs for as much as 50%. As a result of these changes, Kathy's health care expenses will exceed her income. To quote Kathy, quote, the claim that only substandard policies were canceled is a lie. The plan I was on was a good policy, unquote. She does not trust the new healthcare.gov website and feels that there is not adequate security to protect her personal information. In her words, quote, I wouldn't touch the exchange with a 10-foot pole, unquote. She is not alone in feeling this way, which spells trouble for these new health care exchanges and for the President's health law. Mr. President, I yield the floor.
Thank you very much. The Republican time has expired.
Mr. President.
The senator from California.
Mr. President, we have seen an array of my Republican colleagues come to the floor, which is their right, and I'm glad the government's open, so they have their staff to help them prepare their speeches. But I have to say this is typical of the Republicans when it comes to health care. All they do is criticize, and not one, because I monitored the speeches, gave one new idea of how to make sure that our citizens are protected with the insurance they have, or how to insure the 48 million uninsured Americans. Not one, but this is the way the Republican Party has been for years. Let's look at what happened when Medicare came to the Senate floor and to the House floor. Medicare, which is one of the most beloved programs. 60% of Republicans in the Senate and 50% of House Republicans voted against Medicare in 1965. Representative Durward Hall, a Republican of Missouri, said, quote, "We cannot stand idly by as the nation is urged to embark on an ill-conceived adventure in government, the end of which no one can see and from which the patient is certain to be the sufferer." This is typical of Republicans through the generations. Every time we've tried to expand health care, they've opposed it and tried to derail it. Senator Millard Simpson, Republican of Wyoming, said, "I am disturbed about the effect this legislation would have upon our economy and upon our private insurance system." That's what they said about Medicare. And they read horror stories. They read horror stories about it. Now, here's what the Republicans aren't saying. They are saying that there is a problem with the health care law that needs to be fixed, which is that people who want to keep their substandard plans are having trouble keeping their substandard plans. Now, President Obama has already said he's going to fix that. There's legislation to fix that. We'll fix it. But that's not good enough for my Republican friends. They just want to tear it down, just like they wanted to tear down Medicare. More recently, they wanted to tear down Medicare. So this is an ancient history. Let's be clear. In 1995, Dick Armey, the Republican House Majority Leader, said, Medicare, quote, "is a program I would have no part of in a free world." This is the Republican sentiment about health care being offered to our people. The same year, after leading an effort to raise premiums and costs for seniors, Newt Gingrich said Medicare was, quote, "going to wither on the vine." And now we have Tea Partiers standing there saying, "hands off my Medicare," okay? That's how out of touch the Republicans are with where the people are. Senate Majority Leader Bob Dole bragged in 1996, "I was there fighting the fight, voting against Medicare, because we knew it wouldn't work in 1965. And now Paul Ryan's budget ends Medicare as we know it. So let's be clear. When you see almost the entire Republican caucus come down here and try to repeal the Affordable Care Act, this is not just stemming from today or yesterday or a glitch in the website or a problem that we have to fix about people losing their substandard plans. If they want to keep them, we'll figure out a way to help them fix it. Notice that they never said anything about the good that the Affordable Care Act is doing for millions of people. Because of the Affordable Care Act, Mr. President, 3 million young adults are now insured on their parents' plan, and yet they want to repeal the Affordable Care Act. What's going to happen to those 3 million young adults? 71 million Americans are getting free preventive care, like checkups, birth control, immunizations. 17 million kids with pre-existing conditions like asthma and diabetes can no longer be denied coverage. So, they want to talk about people who are having a problem. We're going to fix it. We think it's about 5% of the people, but even if it's 1%, we should fix it. Now, yesterday we learned that in the first month of the open enrollment period, 106,000 or 1.4% of consumers are going to sign up. If you look at Massachusetts during its first month, and Mr. President, I'm sure you're aware of this, being in New Jersey, close to Massachusetts, only 0.3% or 123 people signed up for coverage out of the 36,000 who ultimately signed up in the first year. So let's be clear. We all wanted to see bigger numbers, but the Affordable Care Act numbers are 4 times better than what Massachusetts did in its first month. And if you talk to the people of Massachusetts, they loved their health care plan. And our plan is based on their plan. By the way, a Republican plan. Hundreds of thousands have started the enrollment process, and I'm one of them. I've created an account, and I'm going to go shopping and buy my plan. But I'm taking my time because I have some time till December. I'm going to discuss it with my husband. We're going to decide what's best for us. I'm going to sign up. You know, I think it was Secretary Sebelius said, this isn't like buying a toaster. This is a commitment for a year, and you've got to take your time. So don't come here and tear down the Affordable Care Act without having to put anything in its place and focus on one problem that the President said he's going to fix, and we're going to fix it. Things are going to pick up. I want to tell you the great news about California. Just in the first 2 weeks of November, California's enrollment has doubled. Our story is a really good one. There's a huge amount of interest in California. People are enrolling. We do have a good website. That's important. People are finding affordable care health options. At the end of the day, when the kinks are worked out, I believe the California experience will be repeated across the country to the benefit of all our families. So let me break down some of the numbers from California. We are the largest state in the union. And we're always, I hate to say this to my friends here, but we're always ahead of the curve. And during the month of October, 370,000 Californians began the process of signing up for private coverage or Medicaid through our health insurance marketplace, Covered California, coveredca.com. Of those, over 30,000 Californians enrolled in health exchanges plans, and over 72,000 applied for Medicaid. So let me just say, we are off to an excellent start in California. In October, there were more than 2.4 million unique visits to Covered California. In other words, this doesn't count people going back and back. Unique visits. And more than 249,000 calls were made to Covered California call centers, and they've got it down to just a couple of minutes of wait time. To date, more than 17,000 counselors, agents, county workers, and others have been certified to offer in-person assistance to Californians. But look, you've heard the horror stories from over there. One side of the story, people having a problem, we're going to fix the problem. Let me tell you and quote to you what Californians are saying. And these are all quotes. I enrolled online on Monday, exclamation point. No website troubles, exclamation point. Took me about 15 minutes, exclamation point. I'll be saving $628 a month after January 1st, exclamation point. So grateful, exclamation point, unquote. Very short wait on the phone. This is another. Helpful, cheerful person to talk to. This online app is very easy. Thank you. And another. The insurance package I'm getting is more comprehensive and way cheaper than the one I've had for the last 9 years. Thank you for creating the marketplace and making the information more accessible and understandable. Another. I find the new coverage provisions to be amazing compared to what was out there before. Many of the plans are cheaper than anything I've seen before, and the one I chose has zero deductible. Another, simple, straightforward, and intuitive. I haven't had health insurance since 1985, so this site has made it unexpectedly easy to enroll. Thank you. So, what we heard from the Republicans is, from a group of people we're going to help who have substandard plans, they don't meet the standards of the Affordable Care Act. Sometimes they're called junk plans. Some are a little better than junk. Many of them are not there when you need them. And people, I have to say, to come down here and echo that sentiment without saying the good things that have been done is outrageous. I'd ask for 2 more minutes.
Without objection.
So we now know the history. We now know, because I shared with you, the history of the Republican Party. Sad to say it, but they opposed Medicare when it went in. They tried to tear it down. They still are trying to tear it down in the Ryan budget. They come down here and they talk about a problem that exists that we're going to fix. They never said the president's going to fix it. He may be on the way to fixing it in moments here. But they ignore the fact that the sign-ups are ahead of where Massachusetts was at this time. So let me close. Sage McAllister from Castro Valley told me how the law is helping her family. She was able to get insurance for her 7-year-old daughter, Leah, who was born with an autoimmune disorder. Sage said that before the Affordable Care Act was passed, she applied to 8 different companies to try to get insurance, but none were affordable. After the law went into effect, she was able to get insurance for Leah for $8 a month. Leah was able to get a procedure done to treat a spinal cord problem that could have resulted in paralysis. Sage said that without the Affordable Care Act, my family, and this is a quote, would be bankrupt, and Leah wouldn't have gotten the health care she needs. Obama saved my family from financial ruin, said another constituent, Jeanine Reed. So here's the deal. Let's be fair. Come down to the floor, one after the other, and shed light on one problem we're going to fix that the president said he's going to fix, and then say you're going to repeal the whole thing. You sound just like your predecessors who said Medicare, terrible idea, Social Security, awful idea. That's what this is about. We're going to make history here. We're going to do the right thing. We're going to fix the problems. And there will be more, because that's what happens when you are tackling this big issue. But at the end of the day, we will be a better nation, a healthier nation. Our children will have a brighter future. And I'm just here to say, I stand with those who want progress. We're not going to tear something down like they want to do and go right back to where we were before, with parents like these having to choose between feeding their families and giving their kids health care. Thank you, and I yield the floor.
Mr. President.
The senator from Connecticut.
Thank you, Mr. President. Thank you to the senator from California for telling the stories of people in California, which are not unlike the stories in Connecticut, an exchange that is working, a flood of people signing up way above expectations for where we originally thought the numbers would be. And I thank her as well for pointing out what is the reality, which is that over 40 times Republicans in the House of Representatives and in the Senate have voted to repeal the health care reform law, and even well over the last 5 years, using over and over again this mantra of repeal and replace, they've offered absolutely no replacement. And Mr. President, there was a story in one of the trade publications down here this morning saying that the Republicans were just going to change their strategy, that instead of piling on repeal vote after repeal vote, they were now just going to come down to the floor and use their committee chairmanships to simply criticize the law and shelve for the time being their incessant efforts to try to repeal the law entirely. But make no mistake, that continues to be their intention. Well, they are going to come down to the floor of the Senate, as they did this morning, and tell a handful of anecdotes about people who are dissatisfied with the law. Their true intention is to get rid of the entire law and go back to a world in which 30 million people in this country had no access to insurance, that if you got sick, you'd lose your insurance, a world in which insurance companies essentially set the rules of the game to the disadvantage of providers and of patients. That's what the agenda is here, to repeal the law and go back to the status quo, which is unacceptable. The highest number of uninsured citizens in the industrialized world, the most expensive health care system, by a factor of 2 compared to all of our G20 competitors. And I get it that there are people who are unhappy, and the president is going to make an announcement later today which is going to set a path forward to try to fix one of the issues with the law with respect to canceled policies. But let me tell you a couple other stories about what the reality of the old system was. Kyle is today about 11 years old, but when he first came into my office, he was an 8-year-old living with hemophilia. Kyle's an amazingly brave young man who inspires courage in his parents. But Kyle has to get 3 to 4 injections a week in order to treat his hemophilia, and each one of those injections costs $3,000. Now, his plan prior to health care reform had a feature in it that most people didn't know was included in their health care plan. That was a lifetime cap on the amount of money that his health insurance company would pay for his care. Now, because Kyle was mounting up bills in the tens of thousands of dollars every week, his family was going to hit that cap very quickly and then be on the hook for those $3,000 injections that Kyle needs to take 3 to 4 times a week. That was going to bankrupt Kyle's family. They thank their lucky stars that we passed this health care reform law, because now their insurance has to be real insurance. It protects them against their lifetime exposure of high health care costs. Think about the Bergers from Meriden, Connecticut. Betty and her husband had insurance their entire life except for a 2-week period of time when Betty's husband switched jobs. And during that 2-week period of time, their son got diagnosed with cancer. And because that was then a pre-existing condition, her husband's new insurance plan wouldn't cover their son's treatment. Their story, unfortunately, can be told millions of times over across this country because the Bergers went bankrupt. They lost their savings. They lost their house. They lost everything as they mounted up huge bills to pay for their son's cancer treatments just because he got diagnosed during a 2-week period of time in which their family had no health care insurance. That practice ends with the implementation of this health care law. No sick person can be denied insurance simply because of a pre-existing condition, simply because a diagnosis happened to happen during a small window of time in which your family didn't have insurance. I get it that the road has been a little bumpy as we have implemented this new health care system, but it is nothing compared to the bumps that have been encountered by millions of families across this country who have been abused by a system that simply does not work. The Assistant Majority Leader is on the floor, so let me just close by talking about Connecticut's experience. If our biggest problem is that enough people who don't have insurance aren't signing up quick enough for insurance, and that's a problem that I will accept because it's a problem we can fix. If all we're talking about here is just the pace at which people are going from uninsured to insured, then we can fix that. We can fix that because we know the product is good. Senator Boxer talked about the Massachusetts experience in which during the first month of their enrollment for the Massachusetts Exchange, only 0.3% of the total signed up during that month. Why? Because people take their time. This is not an easy decision to sign up for health care. But in Connecticut, where we have an exchange that's been up and running, a website that is working, in the first month, you know what our number was? It wasn't 0.3%. We enrolled 10% of our expected total in the first 30 days. And here's what people say about their experience with Connecticut's exchange. One person said, "This is a great resource for Connecticut residents to apply for health coverage, thanks to the health care law." Another said, "I chose Access Health because I'd been denied in the past by other carriers before this law changed." Another said, "Thank you so much for this health care law. I haven't been insured in a decade. I am so, so thankful." Another said, "Thank you for this program. I lost my job a year ago and couldn't find anything that I can afford in health coverage before this law passed." Finally, another said, "Thank you. This law is helpful and appreciated. God bless America, and thank you, President Obama." The President's going to make an announcement that will paint a path forward for the relatively small number of Americans, 4%, who get their insurance in the individual market, some of which have had their plans canceled. But the solution with respect to the timing of enrollment is not to abandon the law, as is the real agenda of people on this floor. The solution is to fix the problem so that, like in Connecticut, more people across this country can, for the first time, have access to affordable, quality health care. Thank you, Mr. President. I yield the floor.
Senator from Illinois.
Mr. President, I want to thank my colleague from Connecticut and my colleague from California for coming to the floor. You see, for the last hour, Republican senators have come to the floor and told a number of stories about individuals and the difficulties they've run into with health insurance. And I don't dispute the facts that they brought to the floor, but I do dispute their characterization of what America faces at this moment in time. I supported the Affordable Care Act. I believe it was the right thing to do. I still believe it. I'll tell you right off the bat, and most Democrats and Republicans would agree on this part, it's off to a rocky start. This website that was supposed to be ready October 1st, we're told will be ready by November 30th. I hope it is, and the sooner the better. I'm told it's improving by the day. That's good. Americans need access to information about health insurance. And when they have that access, they can do something, for many of them, for the first time in their lives, go shopping for health insurance. You know, there are a lot of people who've never had that luxury. Some have never had health insurance one day in their lives. Others have been given a take-it-or-leave-it situation with a policy that may or may not be worth anything. I listened carefully to the Republicans for a long, long time on the issue of health insurance. I've heard a lot of criticism, a lot of complaint. They want to defund Obamacare. They want to delay Affordable Care Act. They want to destroy it. They don't have an alternative. Oh, we want to repair and replace it. Well, let's hear your proposal. We never heard one during the course of our debate on creating this law 3.5 years ago. We kept waiting for the Republican plan. The honest answer is they had none. And apparently they still don't. The reason they don't is they fall back and say, let the marketplace decide. Well, many of us know the marketplace in health care personally. We know a marketplace that has turned away 40 to 50 million people who are uninsured in America. People who still get sick, still go to the hospital, and whose bills are paid by everyone else. The Republican Party is supposed to be the party of responsibility and rugged individualism. What about the responsibility that we all have, if we can afford it, to have health insurance, and as a country to provide the means for those who can't afford it so they can have protection too? That, to me, is responsible. Trying to just stop this reform is irresponsible. When you get into the specifics on the Affordable Care Act, you never hear a Republican senator come to the floor and make a case against the specifics. You know why? They can't. Is there a Republican senator who will come to the floor and defend the right of a health insurance company to turn down a person or a family because of a pre-existing condition? That's the situation we faced when we passed the Affordable Care Act. Is there a family in America that doesn't have someone with a pre-existing condition? Most families do. My family has in the past and does now too. And pre-existing conditions can range from the very, very serious to things which are chronic and manageable, from asthma and diabetes to cancer survivors. The list is long. The Affordable Care Act says you cannot turn down a poor person in America for health insurance because of a pre-existing condition. The Republicans say they want to repeal that. They want to go back to the day where you can turn down a person because of pre-existing condition. Then have the courage to come to the floor and say it. They won't. The bill also says, the law also says, you can't limit the lifetime payout on a health insurance policy. There were a lot of people who thought $100,000 was a lot of money for health care until they got into a serious situation. One diagnosis, one serious disease, one accident away from medical bills that would wipe out $100,000 in a day or two. So we put in the Affordable Care Act there can be no upper lifetime limit when it comes to the payout under the health care insurance policy. The Republicans say they want to repeal it. I challenge any Republican senator to come to the floor and explain that one. Did you know as well, Mr. President, that of the family policies sold in America, 60% of the family policies did not cover maternity benefits? We require the coverage of maternity benefits. Now, let me tell you, my wife and I are not in a situation where we're likely to ever use those personally, but we happen to believe that it's a good thing across America, and it's a family-friendly thing across America to make sure that policies cover maternity. Those who talk about family values and love of family and love of babies and children, why in the world wouldn't you want to include that protection in all family policies? Spread the risk across the population, but make sure every family can afford to have prenatal care for a healthy baby and a healthy mom when that blessed event arrives. I'm waiting for the first Republican to come to the floor and say that's a bad idea, too. Incidentally, health insurance policies used to discriminate against certain groups, particularly women. We said that's over. You can't discriminate against women and treat them differently. You've got to be fair in the allocation of this risk, and you can't use gender as a basis for increasing the cost of a policy. The Republicans want to repeal that. I'm waiting for the first Republican senator to come to the floor and say health insurance policies, because of the free market, should be allowed to discriminate against women. That's a reality. The other thing we provided in the Affordable Care Act, finally, families with children coming out of college looking for a job can keep their kids on their health insurance policies to the age of 26. We don't know exactly how many are helped by this. Some estimate 300,000 plus young people still on their families' policies. Why is that a good thing? Because a lot of young people coming out of college don't find a job right away. And some that do may not have a full-time job or benefits. If you've ever been a mom and dad, and I've been in that circumstance as a father, where I called my daughter and I said, Jennifer, do you have health insurance? Dad, I don't need it. I'm healthy. You know, those are things that keep you up at night. The Affordable Care Act provides additional protection for these young Americans who are just starting out in life and trying to find a job. The Republicans want to repeal it. I'm waiting for the first Republican senator to come to the floor and make that case. Oh, we should make sure that young people in their 20s don't have health insurance. That's the result if you repeal the Affordable Care Act. And what about senior citizens? Medicare Prescription Part D provides prescriptions so senior citizens can stay healthy, independent, and strong for as long as possible. And the problem we had, of course, was something called the donut hole. It meant out-of-pocket expenses seniors had to pay for those prescriptions. We are closing and filling the donut hole so that seniors aren't giving up their life savings in order to have the prescription drugs they need for a healthy life. They want to repeal that. They want to repeal the Affordable Care Act. I'm waiting for the first Republican senator to come to the floor and say seniors ought to pay more for the prescriptions they need under Medicare, because that's the result of repealing the Affordable Care Act. Now, let me just also say this. Life experience tells us several things. First, premiums on health insurance go up with some frequency. We're trying to slow down the rate of growth, but they've been going up for a long time. In some markets, for example, when it comes to individual policies people are buying, those have gone up rather dramatically, sometimes 15% a year for a long period of time. Secondly, in that market of individuals buying health insurance, 67% of those policies are canceled every 2 years. So now they come to the floor and tell us stories about premiums going up and cancellations. Can I remind my friends on the Republican side that's been going on for a long, long time. Now they blame every cancellation on the Affordable Care Act. They blame every premium increase on the Affordable Care Act. That's just not factual. It's not true. Let me tell you some mail I've received on the subject. Here's an email from a constituent I'd like to read. In Illinois, here's what this constituent writes. As a lifelong Republican, I am absolutely appalled by the extremists who have hijacked my party, and I'm thoroughly ashamed of all the attempts to defund President Obama's Health Care Act. Already, my medical costs have dropped due to early provisions of the act, and if it passes, becomes law, it appears I'll save $6,000 a year on my premiums, health insurance premiums. I realize that not everyone shares my enthusiasm for the health care bill, but I want to make two comments. When the act is broken down into its component parts, polls consistently show that American people agree with the program. Secondly, all I'm asking is that we give it a fair trial, give it a fair chance. Say 2 years. Of course it'll need tweaking and revising. But if it doesn't work, then we can repeal it after 2 years. Quite frankly, obstructionists are a public embarrassment to those of us who grew up with a different Republican Party that cared about people and was not madly trying to exclude as many as possible through hateful bigotry and racism. This is too important to let it fail. I stand with the President and the Democrats on this issue and hope that you'll do everything in your power to see the Health Care Act remains in force. Now take a look at what's going on out in this country. There have been senators from states that have come to the floor, and I'll use as an example the senators from the Commonwealth of Kentucky, both of whom have come to the floor and called for the repeal of the Affordable Care Act. Well, let's take a look at the numbers. With a flawed startup, which I'll readily concede, what is going on in the state of Kentucky? In the state of Kentucky, this according to the Washington Post, 76,294 people have already submitted completed applications under the new health care law. 39,207 are eligible to enroll in a plan, and as of this date, 5,586 have selected a plan. Kentucky is leading on a per capita basis. Many other states, some larger, some smaller, Kentucky is leading while its two senators come to the floor and rail against the very health care law that the people of Kentucky apparently need and want and are exercising their right to choose. I want to salute Governor Beshear in Kentucky. He stepped up and said, get out of the way. If you don't want to help Kentuckians to good health care, then get out of the way. We're going to give them a chance, and he's doing it. Other states, fighting the President, fighting Congress tooth and nail. They aren't going to cooperate at all. And we wonder why the startup has been slow. Without that cooperation, it makes it more difficult. I'm not making any excuses for the website. It's got to be improved. It's got to be better, and it will be. Take a look at that experience in Massachusetts. Senator from California talked about that earlier. During the first month of enrollment in Massachusetts, 123 people signed up in the first 30 days. By the end of the year, though, 36,000 had signed up. The number of uninsured young people went from 25% to 10% within 3 years. Massachusetts today, because of the leadership of Governor Mitt Romney and the cooperation of the Democratic legislature in that state, has nearly universal health insurance coverage. However, the rollout wasn't without some problems, just as ours is. The current governor, Deval Patrick, said there were a series of website problems. He also said the website was a work in progress for the first few years. There were outages during peak times and problems searching for providers. I recently met with a doctor from Boston. He's one of the best. He said people in Massachusetts can't remember what it was like before. They can't remember what it was like before people had health insurance. This doctor is an oncologist. He deals with people who are diagnosed with cancer. He had a 19-year-old woman come into his office before they had this version of the Affordable Health Care Act in the state of Massachusetts. And he said to her, we can cure you, but we've got to really do this aggressively. It's going to take chemo, it's going to take radiation, and it's going to take surgery. This 19-year-old young woman said, please don't tell my parents. I can't afford to pay for this. If they hear this, they're going to mortgage their home to pay for my medical care, and I don't want them to do it. Well, the parents learned. And the parents made the decision, and they mortgaged their home, and their daughter's life was saved. This oncological doctor, this cancer doctor said to me, Senator, I've never run into another case like that since Massachusetts passed its Affordable Health Care Act, since people have basic insurance and basic protection. The life and death choices that people make every single day should be front and center here and not the political squabbles that have become the trademark of this town. We've got to understand that there are hardworking people across America who have no health insurance. There are families with people with pre-existing conditions who can't get a decent policy. They're going to be given their chance. We'll be a better America for it. And I would say to the Republican critics, after this is in place, after thousands, maybe even millions of Americans have signed up, you're not going to take it away. They're going to fight to keep it, and I'm going to stand by them in that fight. to make sure that they have supporters and champions on the floor of the Senate.
Would the senator yield through the chair for a couple of questions?
I'd be happy to yield for a question.
First, can I just thank you so much? I'm so glad you're here, and I see Senator from Colorado's here as well. It was so interesting to see Republican senator after Republican senator come down here to focus on one of the problems we're having and are going to fix. And not one of them touched any of the issues that you spoke about or I spoke about or the senator from Connecticut, which is the broad look at what we were facing when we passed the Affordable Care Act, the benefits that have gone into place that are saving our families from bankruptcy and saving lives. And I know my friend was very clear on this. And I think when you said, Senator, that to see this become all about politics is something that is so wrong. We all know there's time for politics, and you and I, we're into that. We understand that. There is a time and place. There's also a time and place to put that aside and help our families. And I wanted to ask my friend a couple of questions. Do you not remember, as I do, that years ago, as we were facing a crisis in health care in this nation, before the Affordable Care Act, that we found out from constituents over and over that their insurance company would walk away from them just at the time that they got sick. They thought they had a policy, like some of our people think they have good policies that don't meet the standards, but when they got sick, I remember constituents saying they'd get a call saying, you know, back 5 years ago, you didn't mention the fact that you once had high blood pressure. We're sorry. We're canceling your policy. Does my friend remember that? And does my friend remember learning, as I did with shock, that being a woman was really a pre-existing condition? For example, if you were a victim of abuse as a woman, they said you were too much of a risk and they turned you away. Does my friend remember just those two problems before we tackled the Affordable Care Act?
I thank the senator from California. Responding through the chair, there was a time as a member of Congress and as a senator when this was a normal request. People would call your office and say, I'm at my wit's end. My health insurance company won't cover the problems that my family faces. Can you make a call to an insurance executive? And we have, almost to a person. Members of the House and Senate have done it, trying to advocate to get them to open up coverage under a health insurance policy. That was the reality. And frankly, many of these health insurance companies, any excuse would do. They would disqualify people on pre-existing conditions because as an adolescent, the insured had acne. Acne, a pre-existing condition, subject to disqualification. Well, I see the senator from Colorado's on the floor, and I want to yield him some time. I thank my colleague from California for coming forward. I just hope at some point the Republicans who are so adamant about repealing and ending Obamacare, as they call it, or the Affordable Care Act, would have one good idea on their own about providing affordable health insurance for the people across America. We all share that responsibility, and I yield the floor.
Mr. President.
The senator from Colorado.
Mr. President, I will first say to the presiding officer what a joy it is to see you in that chair, and welcome to the United States Senate. I wanted to talk today about the Drug Quality and Security Act for a few minutes because at this moment of dysfunction in the Congress, we are at the brink of accomplishing something that we've not been able to do in the last 25 years, the last quarter of a century. This bill, which we are about to send to the President, reforms our drug distribution supply chain, making it more secure and safer for families. It puts us on a path to electronic interoperable tracing at the unit level for drugs. It also raises the bar for wholesale distributors around the country and weeds out bad actors who find loopholes in the system to stockpile drugs and create shortages. This bill cannot come soon enough. Mr. President, our Colorado pharmacies fill over 60 million prescriptions every single year, and the Coloradans who take these prescriptions, just like people all over the country, expect their medicine to be safe. And the sad fact is that, given the current laws in place, we can't guarantee this. Pharmacists cannot determine with any certainty where a drug has been and whether it has been secured and safely stored on its way to the pharmacy. Right now, you can get more data from a barcode on a gallon of milk than you can from one bottle of aspirin 2 aisles over in the store. The normal chain moves drugs from a manufacturer to a wholesaler to a pharmacy. Under the current patchwork of state laws, drugs travel back and forth across state lines among repackagers, wholesalers, and pharmacies with no real oversight by anybody. The more times that a drug goes back and forth, changes hands, the more opportunities criminals find to enter the system. And in the last decade, this lack of oversight has created an enormous gray market in the United States of America. Companies can stockpile drugs that are in high demand and sell them later at dramatically higher prices. Hospitals in Colorado are bombarded by daily calls and messages from various businesses around the country offering them drugs that are on the FDA drug shortage list and unavailable through their contracted wholesaler. According to a recent study by Premier Alliance, which includes 30 Colorado hospitals, sale prices of drugs that are in shortage are on average 650% higher than the contracted prices. These hospitals have no idea, absolutely no idea, whether the businesses that are approaching them are reputable and how they can have supply of these drugs that are in shortage. Investigations into the gray market have shown that current law offers a huge incentive to make outrageous profits at the expense of patients, whether through selling and reselling or counterfeiting or tainting drugs. A little over a decade ago, criminals in Florida made $46 million by counterfeiting 110,000 doses of Epigen, a drug used to treat anemia, a side effect of chemotherapy and dialysis. These criminals sold the counterfeit drugs to pharmacies around the country. The FDA recovered less than 10% of the counterfeit product. In 2009, nearly 130,000 vials of insulin, a temperature-sensitive drug to treat diabetes, were stolen and later found across the country and even in a national pharmacy chain. The FDA, which had been notified that patients who used some of the insulin were reporting poor control over their insulin levels, were able to recover less than 2% of these stolen drugs. And just a few years ago, $75 million worth of drugs were stolen from an Eli Lilly warehouse and later found in South Florida, becoming the largest drug heist in the country's history. And just this year, the FDA notified the public about counterfeit Avastin, a drug used to treat cancer, which was being sold from a licensed wholesaler in Tennessee. These stories should scare any person in any state who takes a prescription, but fortunately, the practical compromise that is before us today will give consumers and businesses around the country peace of mind. Over the next decade, manufacturers, repackagers, wholesale distributors, and pharmacies will form an electronic interoperable system to track and trace drugs at the unit level. The barcode on our pill bottles will soon tell us who has actually handled the medicine we take and give to our children. Starting in 2015, Mr. President, the FDA will also know where every drug wholesaler is located across the country and begin to ensure that all wholesalers meet a minimum national standard. Mr. President, this legislation, after 25 years, is a model of what can be accomplished through hard work and pragmatism in the United States Congress. This bipartisan effort has the support of business groups, such as Pharma and Bio, as well as consumer groups, such as the Pew Charitable Trust and many others. I cannot say enough about the leadership of Chairman Harkin and Ranking Member Alexander in driving us to get consensus on this bill. Their commitment to track and trace, as well as compounding, sets an example that I wish could be replicated many times over. I want to thank Senator Franken and Senator Roberts for their leadership on the compounding part of this bill. And finally, I want to acknowledge the relentless, and that's the only way to describe it, relentless effort of Senator Richard Burr. He's been a true advocate and an outstanding partner with me and my staff. His tireless efforts and that of his staff helped us move this legislation into law. And while we're on that topic, and to close, I want to thank all of the staff who have worked on this important legislation, and I'd ask to submit a list of their names and ask that they appear in the record.
Without objection.
And thank you, Mr. President. And with that, I say I hope that we get a strong show of support. I know we will on the floor of the Senate for this bill, that we get it to the President's desk, and that we restore a sense of safety about our pharmaceutical distribution chain. And with that, Mr. President, I yield the floor.
Mr. President.
The Senator from Vermont.
Mr. President, I realize the presiding officer is not allowed to respond, but I also want to add my words to those of the distinguished senator from Colorado that I'm delighted to see the acting president pro tempore in the chair, and again, as I did the other day, welcome him to the Senate. Mr. President, more than 12 years after the terrorist attacks of September 11th, as we see our military presence in Afghanistan winding down, it's time to take a hard look at our counterterrorism policy. We need to consider which of our policies are working and which, while perhaps well-intentioned when they're adopted in the highly charged weeks and months after 9/11, are not making us safer. And there's ample evidence the status quo is unsustainable. As recent revelations have made clear, we need a careful review of our surveillance activities. For example, this summer, many Americans learned for the first time that Section 215 of the USA Patriot Act has for years been secretly interpreted to authorize the collection of Americans' phone records on an unprecedented scale. Despite the massive privacy intrusion of this program, the executive branch has not made the case that this program is actually uniquely valuable to protecting our national security. That's why I introduced the bipartisan USA Freedom Act with Congressman Sensenbrenner. We wanted to end this dragnet collection. We wanted to place appropriate safeguards on a wide range of government surveillance authorities. But we also must close the detention facility at Guantanamo Bay. In the coming days, the Senate's going to take up and debate the National Defense Authorization Act for fiscal year 2014. Now, that act contains many provisions that are central to our national security, and actually many that help our allies around the world. But among the most important are provisions that would help make it possible to close the facility at Guantanamo. As long as Guantanamo remains open, it doesn't protect us, it serves as a recruiting tool for terrorists. It needlessly siphons away critical national security dollars, but it discredits America's historic role as a global leader that defends human rights and the rule of law. As an American senator, I feel this is not the face of America I want the world to see. Currently, there's 164 individuals who remain detained at Guantanamo. Some of them have been there for more than a decade. More than half, 84, have been cleared for transfer to another country. But efforts to do so have stalled largely due to irrationally onerous restrictions imposed by Congress. These unnecessary, counterproductive hurdles have made it all but impossible to close Guantanamo. But they've also severely damaged our credibility when we criticize other governments for their use of indefinite detention. We used to be able to do that. Now they look at us and say, how can you speak? Provisions in the 2014 NDAA would ease these restrictions. Now, they're incremental, but they would streamline procedures for transferring detainees to other countries. And where appropriate, they allow transfer to the United States for trial or detention. They're common sense changes. They're necessary for a serious about putting an end to what I believe is an ugly chapter in our history. Now, there's some who are going to come to the floor of this chamber over the next several days. They'll tell us how dangerous, how irresponsible it would be to close Guantanamo. I would answer the facts are simply not with them. The bottom line is that Guantanamo hurts us. It does not help us. Guantanamo does not make us safer. We're all committed, all of us in this body, to protecting the national security of the United States and the American people, but Guantanamo undermines these efforts. Our national security and our military leaders have concluded that keeping Guantanamo open is itself a risk to our national security. The facility continues to serve as a recruitment tool for terrorists. It weakens our alliances with key international partners. Guantanamo doesn't hold terrorists accountable. The military commission system for trying these detainees does not work. Federal courts have recently overturned 2 Guantanamo convictions, and opinions are actually going to prevent the military commission prosecutors from bringing conspiracy and material charges against detainees. That's a fact incidentally acknowledged by the lead military prosecutor in Guantanamo. The charges, however, can be pursued in federal courts. In federal courts, where our prosecutors have a strong track record of obtaining long prison sentences against those who do us harm. Since 9/11, federal courts have convicted more than 500 terrorism-related suspects, and they are securely behind bars. You're not going to do it from Guantanamo. And Guantanamo is also diverting scarce resources from critical national security efforts. At a time when the Department of Defense faces deep and ongoing costs, most Americans would be surprised to know what it costs to maintain Guantanamo. It's about $450 million a year to house 164 individuals. We're spending $2,700,000 per detainee every year, year in, year out. Some have been there for more than a decade. $2.7 million. In federal prisons, which actually costs a lot to hold a prisoner, is $80,000 a year. $2.7 million in Guantanamo. 80,000 are our most secure federal prisons. We've had hundreds of convicted terrorists in there. There's never been an escape. And despite the fact the Pentagon rejected a request earlier this year to spend hundreds of millions of dollars more to overhaul the aging compound, House Republicans included the spending in their version of the National Defense Authorization Act. We can't get money for school lunches for our children. We can't get money for the Women, Infants, and Children program, but we can continue hundreds of millions of dollars more in Guantanamo for something that makes us no safer. Our priorities as Americans are upside down. The money, for example, squandered on this long-failed experiment would be better served helping disabled veterans returning home from war and soldiers preparing to defend our nation in the future. We don't have enough money to do that. We have enough money to keep Guantanamo open. Come on, this waste has to end. Guantanamo has undermined our reputation as a champion of human rights. Countries that respect the rule of law and human rights do not lock away prisoners indefinitely without charge or trial, no matter how much damage they did to us. We condemn authoritarian states who carry out such practices. We shouldn't tolerate them ourselves, even for our worst enemies. We are a better people than that. The status quo is Guantanamo is untenable. I appreciate President Obama's renewed vow to shutter this unnecessary, expensive, and counterproductive prison. But in order for the President's plan to be successful, Congress has to do its part. We have to pass the common sense provisions in the National Defense Authorization Act. So I thank Senator Levin for his leadership on this issue as Chairman of the Senate Armed Services Committee. And I stand solidly with Senators Feinstein, Durbin, and others who long recognized it's in our national security interest to close Guantanamo. It's a fiscally responsible thing to do. It is the morally responsible thing to do. And above all, it'll actually make our country safer. For over a decade, the indefinite detention of prisoners at Guantanamo has contradicted our most basic principles of justice, degraded our international standing. They've harmed our national security. It's shameful that we're still debating this issue. Status quo is unacceptable. Close Guantanamo. Mr. President, I suggest absent quorum.
The clerk will call the roll.
Mr. Alexander. Senators in a quorum call during morning business this morning. Coming up, they are expected to voice a vote to move ahead with formal consideration of the pharmacy compounding bill. Meanwhile, on C-SPAN 1, we're waiting the President to make remarks, and you can watch that live. And while we're waiting for senators to come to the floor here, we'll show you some of House Homeland Security Subcommittee hearing on the LAX shootings.
Hallmark of how we do our work, and at the time, TSA didn't have the data systems that would allow us to substantiate that, but as Mr. Pistol just noted, they have a pilot, a feasibility study underway. They're going to think about better ways to do that.
Thank you so very much. Mr. Pistol, let me conclude with you, please. There have been several, I think, constructive points being made at this hearing. Would you go back and look at this program, this service, as it may be better refined through streamlining, through looking at the at-risk concept that I think you adhere to, through the idea of, I even like the idea, because of the LAX tragedy, of expanding in the outer areas, in an area surrounding the perimeter, so as passengers enter, it might be an appropriate executive fix. Are you willing to go back and look at this program constructively?
Yes, Congresswoman, and that's part of our review. Clearly, we want to make sure we are deploying BDOs and the entire TSA workforce in the highest risk, most return on investment places, times, and situations. So that's clearly what we're doing. As part of the BDO program, we're looking at refining the number of indicators. Is it too complicated? Is it confusing? How can we streamline, to your point? How can we simplify the whole process to give the greatest return on investment?
Mr. Chairman, if I may just put a question on the record and ask you, let me thank you and the ranking member for this hearing. I would offer a thought based upon Mr. Edwards' comment and some more pointed questions that I'd like to ask, that we have a classified briefing on the BDO pursuant to or in light of LAX and a lot of our concerns about the exterior, meaning when I say the exterior, there's the perimeters of people driving up. That's one issue. But I'm talking about the lead up to the TSA area, the ticketing area, people walking up, which is where this gentleman was. So he had to walk somewhere. And the question was there some officer other than the law enforcement who deals with the actual activity of violence or activity, but someone watching that area. So, again, no determinations here, no commitments here, but prefer not in the open setting. But I would like to have the opportunity, if we could, to have that discussion.
Happy to work with you on that.
Thank you, Mr. Chairman. Thank you very much. And again, thank you for your service. Thank the gentleman from Nevada as well.
At this point, I will recognize the gentleman from Nevada, Mr. Horsford, for 5 minutes.
Thank you, Mr. Chairman. I'd like to ask the Administrator if he could go ahead and answer the question about the TSA not being able to have a pre-approved vendor list, what the challenges are to implementing a process.
We looked at doing a qualified products list to say we would recommend or we would accept if you bought these particular pieces of technology from these manufacturers. We're trying to be open to all vendors, all providers, so it's not like we are pre-selecting one and say you must go with this one. So McCarran may have contact with a vendor that has one solution. LAX may have contacts with another vendor with a different solution. So we tried not to be prescriptive in that regard, try to be completely open to whatever vendors and solutions that airports would provide. So what we've done is provide a template to say, here are some recommended solutions, and then if you work within those parameters, just make sure you coordinate that with your local federal security director. These, more likely than not, would be approved, as opposed to saying from a qualified product list, here is this, the exact product you have to use.
So I'd like to ask if I can follow up with you and someone from your office in that regard to make sure that that process is clear to the local airport directors. Thank you.
Yep.
Also, Administrator, in fiscal year 2014, TSA reduced the number of airports where the SPOT program operates from 176 airports down to 121, a reduction of 55 airports. So the agency did this despite your own analysis that said you actually needed to increase the number of behavior detection officers. So first, my question are the airports where the SPOT program has been removed less secure today because they don't have the BDOs, and if not, why not?
Yeah, so this goes back to actually a GAO, the 2010 report that recommended that we assess our deployment of BDOs across the risk landscape, my words. And so under a risk-based security approach, what we've done is looked at those 175 and made a judgment that our return on investment in terms of being able to see and observe the greatest number of passengers in the highest risk airports would be better suited by reducing the footprint from across the country, basically the peanut butter approach, just spreading resources equally around the country to those higher risk and higher passenger airports. And so that's what we've done under this risk-based security initiative to say we will be in generally the 121 busiest airports around the country. So we will be observing over 80, maybe as high as 90% of all passengers, so we get a better return on investment. In an ideal world, yes, I would have BDOs at virtually every airport, and so there is some argument to be made that those airports have less security. But we're not in a time, as you know, of unlimited budget, so I have to make a risk-based decision based on our budget, and so that's why we have.
The Majority Leader.
Ask unanimous consent to call the quorum be terminated.
Without objection.